Ladies and gentlemen, let's talk about the inconvenient truth that radical activists don't want you to hear. The stories of detransitioners.
For me, transitioning was the closest I could come to killing myself without actually doing it. With all of these mental struggles that I was having, not knowing how to make sense of it on my own, and consuming so much of the trans narrative,
and just loving life.
Hearing people say this made me so much happier. This alleviated my pain. I wanted to alleviate my pain. I also didn't want to be who I was. So, with transitioning, I could do both of those things. I could alleviate my pain and I can become someone else. I wanted to escape my own identity as Daisy.
My name is Ali Chadra, and this is my voice. One day before testosterone.
That was really the beginning. I wasn't just playing around anymore. I wasn't just playing dress up anymore. Like, I was actually going to become a trans man and live my life that way.
It really started from being a kid all the way through adolescence. I was a little bit more of a weird kid, so when you don't fit in a lot of places, you go with the other misfit kids, which, in my generation, born in 1986, being 36 and all, my generation was the LGBT. I'd say in my late 20s, I think I was 26 or 27, that I got introduced to different lifestyles. And one of those different lifestyles was, hey, do you think you're a girl? Thought about transitioning to a female, and every time I thought about it, I get myself weeks and weeks of coming back to the same idea. It just felt right. You could catch a lot of fish with the idea that men are running towards something. Usually the men that transition to women are either chasing a little bit of attention, chasing something else in them that's feminine, chasing some kind of set of ideals of something they want, and women tend to chase something or run away from something they don't want. There was this identity and this persona and this idea of something I wanted to embody. Got my name changed, got my bottom surgery, got my face surgery, and I thought I'm done, I'm good. Lived that way for a while. Once I healed, my face healed, my body healed, and I felt like I was myself again, I realized I wasn't any happier. The big switch for me was I sat down to take my hormones, I took injections, and then I cleared the air, and it was the medicine was dripping out of the needle, and it just felt very gross to put the needle into my skin again. It felt like I was tainting my body. It felt like, I was drinking poison. I knew it would help me. I knew it would help the way I looked, but I was like, how I look isn't important. I stopped shaving, I stopped putting on makeup, I stopped doing all these things because they weren't part of the true me. They weren't part of, I guess, the more unadorned me. I had to do all this work to make myself look a certain way, and I'm not that type of person. I'm not the type of person that needs to look a certain kind of way. I'm just me all the time. If I tell someone I detransitioned, they will tell me, well, you weren't really trans then. You were mistaken. I am really trans, you weren't.
My name is L. Palmer, Palmer. I was born and raised in Great Falls, Montana. 10 years ago, when I was 15, I came out to my parents as a transgender boy. 1 year later, I was prescribed testosterone at the Great Falls Planned Parenthood. I was 16. I told the doctor about my traumatic female puberty with debilitatingly painful periods, severe suicidal thoughts, and self-harm, and anxiety so bad that I dropped out of school. I told him that I went to Chaudere, the children's mental hospital here in Helena, 3 times before I was 14. You might be surprised to hear that the doctors, nurses, and therapists not only knew these things, but they believed the root cause was due to my internal sense of gender identity. Transition was supposed to be the cure. Not even a history of sex will stop these medical professionals from putting a young girl on testosterone. Even if I had known testosterone would give me prediabetes, high blood pressure, early onset osteoporosis, and an increased risk of sterility, I wouldn't have said no. In my mind, there was no other option. It was transition or die. This myth persists in the LGBT community 10 years later. You'll hear opponents of this bill call this life-saving care. When I was 19, I went back to Planned Parenthood. I told them I was female to male, but I wanted to go back to female. They didn't know what to do. As weeks turned to months, eventually every single doctor had called me back saying, I don't know, maybe another doctor can help you. Planned Parenthood could easily put a teenage girl on testosterone, but no one in the entire state of Montana knew how to treat a woman who just wanted her female body back. Please pass Senate Bill 218 so people like me, who didn't understand the life sentence they signed up for, will have the time and resources to seek the justice we deserve.
My name is Prisha Mosley. I am a detransitioning woman who began my social transition at 15 years old. I was told that my depression, anxiety, PTSD, OCD, and borderline would all go away if I transitioned, but it wasn't true. Starting at 17, high doses of testosterone were injected into my anorexic body. The side effects were severe, are permanent, and started within days. The damage from the testosterone is permanent, however, and I will not heal from it like I healed from my eating disorder. I am also suffering from chronic pain. On top of this, I lost my ability to sing. I cannot raise my voice to scream if I'm in danger. Testosterone silenced me. 1 year after starting hormones, my healthy breasts were removed. The surgery was incredibly traumatizing. My breasts have been incinerated, and I will never be able to feed my children.
In Prisha Mosley's case, which was the very first case we filed, received a landmark ruling. And what the judge ruled is, Prisha's claims for fraud, facilitating fraud, and civil conspiracy will proceed, and that she does have a legally viable case on those claims. This is the first ever substantive ruling like that in a detransitioner case nationwide, and it's a very big victory, and we fully intend to pursue those claims all the way to a trial if necessary.
There's a lot of reasons that people transition. I'm in a detransition community online, and a lot of us have some similar stories and similar reasons. My particular reasons are just a lot of trauma, sexual trauma when I was a kid, abusive relationships, an undiagnosed eating disorder, undiagnosed autism. It was just running away from being a girl in every way. Like I said, I had a lot of sexual trauma when I was a kid, and I felt like none of that would have happened if I wasn't a girl. Internalized misogyny played a big part for me as well. My experience as a man was really good. I actually felt a lot more confident that way and like more brave. My dad passed when I was a baby, and then my stepdad did a lot of, bad things to me when I was a kid, and like none of the men in my life were like protective of me, so I was like kind of becoming that protective person. There's so many things that you can check off a list, and once I do this, I'll be happy, and once I do this, I'll be happy. I was 1 week out from having top surgery, and it was kind of the final thing that I wanted to have accomplished, and I still wasn't happy. And so I was like, well, if I have this done and I'm still not happy, and then what? So I decided to put myself in sensory deprivation for a very long period of time. It was about a day and a half. I was crying, I was really upset, and I was trying to figure out if I wanted to continue doing this or not. Out of the blue, I heard this voice say, when you go to get judged, which name will you use? I was an atheist at the time, and I was like, if there's somebody talking to me right now, then like I need you to make this go away, because I really just cannot deal with this anymore. I was kind of wore out with trying the prayer method, but I did, and it just ceased to be a problem ever since that day. When I joined the detransition group, I had one friend named Alex. He really helped me to realize that since he had done far more to his body than I had, that living a life detransitioned was completely possible. I really considered pretending like none of this had ever happened, but I really can't in good conscience just move forward and see all of these people struggling and just keep my mouth quiet.
My name's Luke Healy. I'm from Stockton, California, and I was in various states of social and medical transitioning for about 10 to 11 years. A little less than a year ago, I detransitioned.
What started this idea in your head that you were actually a girl rather than a young boy?
At kind of a young age, I began to feel somewhat withdrawn from my male peers in particular and my family. One big thing was I didn't socialize by playing sports because of a kind of issue I have with my eyes that makes it hard for me to track horizontal motion. That was really hard on me when I was a kid. And I just felt like I couldn't socialize properly with male peers in particular. I just felt deeply insecure about my place in the world as a little boy.
What did you initially learn about transgenderism then?
the website Tumblr, and then a friendship with a young woman in school who was flirting with a lot of these ideas. I would be in group chats, conversation with adults who were propagating materials related to this and related to other mature themes, up to, outright pornography. 10 years old, I began to see this on the internet. Exposure to sexualization, pornography in particular, but sexualization in general, was maybe one of the earliest and one of the most decisive factors of my kind of slide into transgenderism.
How old were you when you started learning about this, and then once you actually decided to go into this lifestyle?
So when I was 11 years old, I was definitely learning about this stuff and getting into it and getting more immersed, but I was somewhat private about it outside of between me and that aforementioned friend I had in school and the friends on the internet, all these adults on the internet coaching me sort of. But I came out to my parents when I was around 13 years old. I told my parents that I was a pansexual transgender female. The amount of adult coaching into these ideas that I had to have to go through with these thoughts and these actions towards my parents, it's astronomical.
At what point did you actually start taking any interventions? What did the course of that look like? What did you take?
21 or 22 years old was my most consistent period of nonstop hormonal use. Before that, in those years, I had very inconsistent treatment that was mind-shattering. I mean, I'm literally dumping female hormones into myself. None of these doctors cared if I had been on the medicine before or what was going on with me, right? I had psychiatric medicines on board. I was using various illegal and legal substances concurrently with this, and no one bothered to ask. I don't even 100% know what I've been left with, because there's studies now that are coming out and that are just now looking at the long-term effects of these hormones later on in life. We're talking things like links to multiple sclerosis. I've seen things talking about life expectancy, more likely to get certain types of cancers. I think one of the more horrible things about these medical interventions is that we're doing this giving people no alternatives for treatment of what they call gender dysphoria, and we don't even know what these things do on a long-term basis.
I medicalized 17 years ago at an LGBT center. I'm a CSA survivor. Doctors told me that what was wrong with me and how I felt about my body was not from CSA, even though I went there and said, did CSA make me this way?
CSA?
Yes, a childhood sexual assault. And they said no. They said no. They said being gay is innate and being trans is innate, and what you have is gender identity disorder. They diagnosed me with gender dysphoria, and I believed their bullshit for about 17 years.
Are you willing to tell me everything that you went through?
I had facial feminization surgery. I had sex reassignment surgery. I was on HRT for 17 years. Now I'm on a combo dose because I can't go off. I have multiple health conditions from transitioning young and for transitioning for so long.
Wow. So what was it for you that kind of woke you up to, this isn't what I should have done?
I found out that homosexual transition was environmentally caused in almost every single case by childhood sexual assault or by internalized homophobia or failed boy syndrome. I was given a blanket diagnosis given to anybody who has a body issue as a child nowadays.
Did they ever try to refer you to like a therapist or any?
I went to therapy for a year. I saw psychologists. I was diagnosed. It took a year back then, not 15 minutes, and I was in the South on the East Coast. But they still believed that transsexualism was innate, that gender identity was this innate disorder that people just had, and like CSA didn't really rule you out.
How do you find your story received by people who continue to sort of push medicalization?
They hate me. They call me a bigot. They say that trans women are women. They say that gender dysphoria is a valid diagnosis. I've combed through trans history. I've read all of the old academics who created this. If you go back to like the early 1900s, transition was conceived by old academics who were trying to find a way for homosexuals to exist in a fascist world in Europe. It just so happens that AGP is also real, and that got latched onto. A bunch of AGPs transitioned, and fast forward 100 years forward, and we have an ideology that's based on lies that kids are told to as soon as they have issues. And God forbid you're effeminate and you believe that something's wrong with you as a man because you like pretty things and are sassy.
So how do you identify now?
I'm a gay man.
Have you lost friends or anyone by detransitioning?
I was canceled by every friend I had who was liberal in this city and had to leave the city.
Why is it important for you to be here?
because people are being lied to when they're being diagnosed. They're not being diagnosed with what actually causes the gender dysphoria. They're just being diagnosed with a symptom of a problem. And there are multiple problems that cause those symptoms. And when you don't appropriately diagnose people, you lead them into a life of ruin. All of these interventions are permanent, they're irreversible, and they lied to me.
These individuals, once celebrated for their courage to transition, are now vilified for their courage to speak out about their regrets. Activists preach acceptance and understanding, yet when someone detransitions, they're labeled as traitors or worse. The same community that once embraced them now shuns them. Isn't it ironic? The movement that demands society to acknowledge and respect personal journeys refuse to acknowledge the journeys that don't align with their narrative. When Helen Joyce attempted to discuss the complexities of gender identity, she was met with protests and disruptions. So much for open dialogue and understanding. Chloe Cole's story is a testament to the failures of a system that prioritizes ideology over individual well-being.
My name is Chloe Cole. I'm 18 years old, and I am a former transgender kid. After I got my first phone at 11, I started using Instagram and Snapchat. I started seeing a lot of content that was either feminist or centered around the LGBT, oftentimes very sexual in nature. I was seeing very idealized images of adult women's bodies that I would often compare myself to, and I felt like I couldn't really match up. I started to develop quite a negative view of growing from a girl into a woman. At school, I found it difficult to make and keep friends. I was often an outcast, especially from other girls. I hit puberty at quite a young age. I started getting comments on my body from my other female peers. I started to think like, well, I'm not like other girls. I might just be better off as a boy. And eventually I landed on, well, I guess it just makes sense that I'm actually just not a girl at all. I'm just a boy. I was 12. I was around 12 or 13. I fell pretty easily into this. I was an impressionable kid. I was sexually assaulted in a classroom in 8th grade. That taught me that this part of me would only bring me pain and attention that I didn't want. I didn't realize at the time just how much of a role it played in me eventually deciding to get a mastectomy. By the time I did, it was far too late. When I started the blockers, once all the hormones cleared out of my body, I did have a bit of a honeymoon period starting on testosterone. My hair got thicker, my eyebrows got thicker, my jawline got sharper, and I started to develop a lot more muscle, but it started to cause me some problems physically and emotionally. I started experiencing a lot more anxiety and just a lot more negative emotions in general. I was 15 years old. I was in my sophomore year when I decided that I wanted to undergo a double mastectomy. As they were preparing me for the surgery and checking all my vitals and eventually rolling me into the operation room, I got more and more nervous. I'd say the regret started to creep in a little bit about a few months after my surgery. But it wasn't until I had taken a psychology class and learned a little bit more about child development and breastfeeding that I would no longer be able to breastfeed. At the time, I was just a 15-year-old. I realized that I had taken so much more for myself than my breasts. I was allowed to make this decision at far too young of an age. If I were to go back in time and speak to my 12-year-old self, I would let her know that she's worth so much more than her body and the way that she presents herself and the way that she thinks other people perceive her. It's infinitely more important that she spends time with her family and her friends and getting involved in her community. I've gone through a lot of hardships, and I don't think anything else in my life has affected me nearly as much as transitioning and stopping transitioning has. But I've managed to keep my head up, and I would attribute that mostly to having people around me who I know really support me and care about me. Now that I've seen it all, I just can't imagine operating on a kid like that in good conscience.
It's time we stop silencing detransitioners. Their experiences are valid, their voices matter, and their stories deserve to be heard.